She laughed for 3 months straight. Then she died. Her muscles betrayed her one by one. First her legs. Then her hands. And through all of it, she laughed. Not from joy. Not from madness. From something deep inside her brain that was eating her alive. Doctors found no virus. No bacteria. No parasite. No tumor. Her brain, when finally autopsied, looked like a sponge. Riddled with microscopic holes. As if something had drilled through it from the inside. She was not the first. By the time outside physicians arrived in the highlands of Papua New Guinea, more than 2,000 people had already died. Almost all of them women and children, and the killer responsible was so strange, so impossible, that it would force scientists to redefine what life itself could be. But that was not the strangest part. The strangest part was how it spread. The 4 people lived in the eastern highlands of Papua New Guinea. Isolated for thousands of years, their first sustained contact with Europeans came in the 1930s. Australian patrol officers. Missionaries. Anthropologists. They were farmers, hunters, organized into small villages. They spoke a language unrelated to most of the world. They were also a people who honored their dead through a ritual that would horrify Western observers. And eventually kill them. When a member of the village died, the body was not buried. It was consumed. The 4 believed that eating the flesh of a deceased loved one was an act of profound respect. It returned the spirit to the family. It kept the deceased close. The brain was considered sacred. By custom, the brain and other soft internal organs were eaten primarily by women and young children. The men ate the muscle tissue. This small detail of who ate which part would turn out to be the single most important clue. In the early 1950s, the deaths began to attract attention. Whole villages were losing their women. The disease followed a pattern so consistent it was almost ritualistic itself. It began with a slight unsteadiness. The victim would stumble on uneven ground. Within weeks, the tremors started. The hand shook. The voice slurred. Then came the wide, swaying gait, as if walking on the deck of a rolling ship. Months in, the muscles failed completely. Victims could no longer stand. They sat against walls. Their eyes wandered. Their faces froze into strange masks. And then, in the most haunting symptom of all, they began to laugh. Sudden, uncontrollable bursts of laughter. Without warning. Without reason. The 4 called it Kuru. The word means to shake. But outsiders gave it a darker name. The laughing death. Within 6 to 12 months of the first symptom, every patient died. No survivors. No remission. No treatment. Nothing doctors tried made any difference at all. What physicians found next changed everything. In 1957, Australian physician Vincent Zegers began documenting cases in the field. He was joined by an American pediatrician named Daniel Carlton Gajusek. Gajusek was 33 years old. Restless. Brilliant. Unafraid of remote terrain. He spent months in the highlands, walking from village to village. Examining patients. Performing autopsies in makeshift conditions. Shipping samples of human brain tissue back to the United States. What he found defied every model of disease known at the time. There was no fever. No inflammation. No sign of immune response. Blood tests showed nothing abnormal. Cultures grew no bacteria. Microscopic examinations revealed no viruses. And yet the brains of the dead were unmistakably destroyed. Under the microscope, the cerebellum, the part of the brain responsible for coordination and balance, showed massive loss of neurons. Around the remaining cells were clumps of strange protein deposits called amyloid plaques. and throughout the tissue, those characteristic holes. Spongiform degeneration. The brain looked, quite literally, like a sponge. Doctors had seen this pattern only once before, in a condition called Creutzfeldt-Jakob disease. But Creutzfeldt-Jakob was thought to be a 1 in a million event. Possibly genetic. Kuru was killing entire villages. We are halfway through this case. And the worst part has not happened yet. The big question was transmission. Kuru clearly spread within families, within communities. But how? There was no evidence of person-to-person infection in the usual sense. People who left the highlands did not spread it. Caregivers who handled the sick did not catch it. And yet new cases kept appearing, year after year, in the same villages. The breakthrough came not from a lab, but from an anthropologist. Her name was Shirley Lindenbaum. She and her husband Robert Glass were working in the Fore region in the 1960s, documenting the cannibalism rituals in detail. She noticed something the doctors had missed. The victims of Kuru were overwhelmingly women and children, the same group that consumed the brains and viscera of the dead. Adult men, who ate only the muscle, rarely got the disease. Lindenbaum proposed that Kuru was being transmitted through the funeral feasts. The infectious agent, whatever it was, lived in the brain tissue. When women ate the brains of relatives who had died of Kuru, they ingested the agent. Then they died, and were eaten by the next generation. A closed loop of infection, perpetuated by love and ritual. The Australian government had outlawed cannibalism in the region in the late 1950s. As the practice ended, the incidence of Kuru began to fall. But the deaths did not stop. New cases continued to appear for decades. In patients who had attended funeral feasts as children 20, 30, even 40 years earlier. This long incubation period was one of the most disturbing features of the disease. Something could enter your body in childhood and silently destroy your brain 40 years later. Gajdusek eventually proved transmission experimentally by injecting brain extract from Kuru victims into chimpanzees. The chimpanzees developed Kuru. The infectious nature of the disease was confirmed. In 1976, Gajdusek was awarded the Nobel Prize in Physiology or Medicine for his work on Kuru and what he called slow viruses. But the real answer was even stranger than a virus. In the early 1980s, an American neurologist named Stanley Prusiner proposed a hypothesis that other scientists called absurd. He suggested that the agent causing Kuru, Creutzfeldt-Jakob, scrapie in sheep, and several other diseases was not a virus at all. It was a protein. Just a protein. With no DNA. No RNA. No genetic material of any kind. Prusiner called these agents prions, short for proteinaceous infectious particles. In his model, a prion was a misfolded version of a normal protein found in the brain. When a prion came into contact with a normal protein, it forced that protein to misfold into the same abnormal shape. The newly misfolded protein could then misfold others. A chain reaction. A cascade. Slowly, over years or decades, the brain filled with these misfolded clumps. Neurons died. Holes formed. The patient began to tremble, to slur, to laugh, to die. The idea that a protein could be infectious overturned a central dogma of biology. Every known infectious agent up to that point relied on genetic material to replicate. Prions did not. They reproduced by physical contact, by template, by corruption. In 1997, Stanley Prusiner received the Nobel Prize for his discovery of prions. The theory was no longer absurd. It was accepted. And it explained not only Kuru but a whole family of fatal neurological diseases. The last known death from Kuru was recorded in 2009, 60 years after the first outbreaks were documented. the Fore had stopped the funeral feasts decades earlier. But the incubation was so long that final cases continued to surface in elderly survivors infected in childhood. Today, Kuru is effectively extinct. The villages where entire generations of women once vanished have recovered. Though the social wound runs deep, but the legacy extends far beyond Papua New Guinea. The discovery of prions transformed neuroscience. It explained bovine spongiform encephalopathy, mad cow disease, the outbreak that killed at least 177 people in Britain in the 1990s through a human variant of Creutzfeldt-Jakob. It opened lines of research into Alzheimer's, Parkinson's, Huntington's, all neurodegenerative diseases that involve misfolded proteins clumping in the brain. Some scientists now suspect that the prion principle may lie at the root of every major neurodegenerative disease known to medicine. A microscopic killer with no genome and no metabolism, that arrived in the human story through a ritual of grief and stayed long enough to teach us how the brain truly dies. Next case. A girl who lived for 20 years and never aged past infancy. She survived strokes, tumors, and comas. Her teeth were a child's. Her brain was an infant's. Her body was 16 pounds. And nothing in her DNA explained why.